Hypertension in pregnancy. Classification of hypertension in pregnancy. Chronic hypertension. Onset of hypertension before conception. Hypertension first detected after gestation but before 20 weeks of gestation in the absence of trophoblastic disease and continues more than 6 weeks postpartum. Hypertension first detected after 20 weeks of gestation and continues beyond 6 weeks postpartum. Gestational hypertension. New onset of hypertension after 20 weeks of gestation without proteinuria or features of preeclampsia and resolves within 6 weeks postpartum. Transient gestational hypertension. Transient elevation of blood pressure for a shorter duration, usually for a few hours, which resolves on its own without drug treatment. Preeclampsia. Preeclampsia is new onset hypertension which occurs after 20 weeks of gestation with one or more of the following and resolves within 6 weeks postpartum. Significant proteinuria, evidence of maternal organ dysfunction, evidence of uteroplacental dysfunction. Eclampsia. Eclampsia is the complicated manifestation of preeclampsia, and it is defined by new onset seizures or unexplained coma in the absence of other causative conditions. Preeclampsia superimposed on chronic hypertension. Developing preeclampsia on previously controlled chronic hypertension during pregnancy or within 6 weeks postpartum. Staging of hypertension in pregnancy. Hypertension in pregnancy is blood pressure greater than or equal to 140 by 90 millimeters mercury to 159 by 109 millimeters mercury, having either diastolic or systolic or both values elevated. Target blood pressure control is less than or equal to 130 by 85 to 110 by 70 millimeters mercury. Start oral labetalol on patients without history of asthma. Maximum dose 200 mg TDS. Start oral nifedipine on patients with history of asthma. Maximum dose 20 mg TDS. Severe hypertension in pregnancy is defined as blood pressure greater than or equal to 160 by 110 millimeters mercury, having either diastolic or systolic or both values elevated. The target blood pressure control is less than or equal to 150 by 95 to 140 by 90 millimeters mercury, and subsequently 130 by 85 to 110 by 70 millimeters mercury. If blood pressure is greater than or equal to 180 by 110 or 160 by 110 with preeclamptic toxemic symptoms, start IV labetalol boluses 40 mg, maximum 200 mg, followed by IV infusion up to 160 mg per hour. If labetalol is contraindicated, start IV hydralazine 10 mg bolus, maximum 20 mg, followed by IV infusion 2 to 3 mg per hour. If blood pressure is greater than or equal to 179 by 109 without preeclamptic toxemic features, start oral labetalol or oral nifedipine. Identification of preeclamptic toxemia. Severe preeclampsia. This is a medical emergency in obstetrics with hypertension and proteinuria. It is depicted by the presence of severe headache, visual disturbance, sensory impairment, epigastric or right hypochondrial pain, liver tenderness with or without nausea and vomiting, acute onset shortness of breath, altered mental status, stroke, clonus, 3 beats or more, exaggerated tendon reflexes, abnormal liver enzymes, features of HELP syndrome, oliguria, evidence of acute kidney injury, uteroplacental dysfunction. If these symptoms and signs are present, immediately start antihypertensives to achieve target blood pressure control. A loading dose of IV magnesium sulfate 4 grams should be given over 5 to 15 minutes. IV magnesium sulfate infusion of 1 gram per hour maintained for 24 hours. If eclampsia is present, the infusion should be continued for 24 hours after the last fit. Monitor for magnesium toxicity. Medications contraindicated during pregnancy and postpartum. Antenatal and preconception period, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, beta blockers, thiazide-like diuretics, spironolactone, statins, oral hypoglycemic drugs except metformin. Postnatal period during breastfeeding, the drugs which are contraindicated are angiotensin receptor blockers, thiazide-like diuretics, spironolactone, statins, oral hypoglycemic drugs except metformin. Thank you.